Okay, Lisa, are you here? I don't see you. Hi, Monica.
Hi, Randy. How are you?
I'm good. How are you?
Good. I was just trying to see if I saw Lisa either, and I do not.
Yeah, I don't see her either.
Okay. Oh, here comes Lisa.
Okay. There she is. Hi, Lisa.
Hi, how are you guys?
Doing well. How about you?
Good. I'm going to make sure it's recording this time because last time it didn't. Okay, yes, it is recording.
Okay, let's go ahead and get going. It's 3 o'clock, so go ahead and start the recording, please. Or you already did.
It's good. It automatically is now.
Okay, thanks, Lisa. Hi, everyone. Good to see you all again. Let's go to roll call. And Valerie, are you here?
I am.
Okay. Linda Winstanley, I saw you earlier. You're here. Linda? She might be muted. Julia Weinberg. Okay, Grant, I see you.
Yep.
Hi, Grant. Linda Whitney. I see.
I'm here, but my video isn't working, so I'm sorry.
That's no worries. It's all good. Thanks, Linda. Miranda contacted Lisa and I earlier. She may not be able to make it, so she has an excused absence. Kirsten.
I'm here.
Amber Bowman, I see you as well. Hi, Amber.
Hi.
And then Seamus contacted me yesterday, and he won't be here.
I cannot hear.
I can hear you. Looks like your volume's off. You're muted.
I know, and I can't hear you. I'm not sure. I'm here.
Okay, we'll give you a minute to see if you can figure it out.
Looking for it. Can you still hear me?
We can hear you, Linda. Can you hear us now? No. Randy, while she works on that and to kind of keep.
I've got it now. Yeah.
You got
Okay,
it?
perfect.
Perfect. Okay. All right,
Perfect.
Linda Winstanley, you're here. Got you. And then I just catching up with you, Linda. So we have Julia Weinberg and Miranda. Julia Weinberg is not here. We have Miranda and Seamus who have excused absences. And so we do have a quorum present, so we shall continue, and we'll go to Commissioner Thompson.
Thank you.
Are you here?
I am.
Glad you're here. Good to see you.
Thank
We'll chat with you a little bit further on.
Okay.
And Jill Quackenbush. I don't see Jill. Okay. Lisa, I know you're here.
Jill's
Yeah.
here. She's just off camera right now, but I can see her. And yeah,
Oh, I see her. Okay, great. And then Monica, you're here. And then Shira just sent a message in. I didn't see what it said. Did
it says
Oh.
that
Laryngitis.
Oh, okay. All right. So Shira is not going to be available today. Lori Moore, are you here? I don't see Lori either. Okay. We'll move on then. We do have one guest present who's just going to listen in today. She was interested in our group. Her name is Christy Peschel, and she's just listening in. So let's move on to approval of the agenda. And
Randy,
Yes.
I'm sorry. Jill has her hand up.
oh, hi, Jill. Sorry, I was looking at my agenda.
That's okay. Hey, I was just getting some calls. It sounds like there's a group of students that are in the building in person that wanted to also attend the meeting. So we're going to send them the Zoom link. But I just wanted, if you see them coming in, I wanted to give you a heads up on that.
Perfect. Thank you.
Yep.
Jill.
These are students that we see regularly at the end of the year who have a government requirement to attend meetings. And
Nice.
so they go on the website and they find all the meetings, whether it's a Board of Commissioner meeting or any other public meeting. So we're going to give them a government experience.
Perfect. Love it. Good for them. Okay. Let's move on to the approval of the agenda. Does anybody have any questions, comments, additions on this month's agenda? If not, then I need a motion to approve the agenda as is.
I motion to approve the agenda.
Second,
I'll
I second it.
motion has passed to accept the agenda as is. Let's go to the April 3rd minutes. Any questions, comments, additions, deletions, anything on the April minutes? If not, then I need a motion to approve as is.
I'll move. We approve the agenda as presented.
Okay, second,
I'll second it.
okay, there you go. Motion has passed. And we'll go to public comment. I don't believe we have any guest from the public. Who's that?
Carrie has come into the meeting since then as well, but I guess she's CBH, so she's not
Oh, okay. Yeah, I see her.
a
Hi, Carrie.
guest.
Okay, let's move on. Public comment. We don't have anybody that wants to speak at this point. Presentation. We have Susan Bjarnsen. I hope I pronounced your last name right. From Northwest Senior and Disability Services, the new director. Susan, welcome, and you have the floor for about 10 minutes.
Wonderful. I don't know how much of you guys know about Northwest Senior Disability Services, but my name is Suzanne Bjarnsen, so it's pretty close. And I am the program manager here for Northwest Senior Disability Services, and I've been with the agency for 10 years. Started as case management, and then into our community programs, and now into the program management. And so I'm guessing you guys just kind of want a rundown of what Northwest Senior Disability Services is, what we do here in the county and whatnot. If you guys have questions, just let me know. I don't mind if you interrupt or anything comes up. I may not be able to see who has hands up or whatnot. But just real quick, because I've got some notes over here. I might be looking at my other screen just to make sure I don't miss anything. But basically, we're a local intergovernment agency. And so we serve 5 counties in Oregon. So obviously Clatsop County, we have Marion County, Polk County, Yamhill County, and Tillamook County. And so we're known as the Area Agency on Aging, and we're also referred to as Aging and Disability Resource Connection. And so that's throughout the whole state, actually even the whole country. It's kind of I sum it up as a one-stop shopping for when people have resource information they need, but if they need to get connected with services, that's where we send people to get started. Certainly they can come into our office, but that's a great place to start. Our funding comes from federal and state government, and we also receive some donations as well from individuals and community groups. And we, like I said, in our 5 counties that we serve, we also have a board of directors. So that consists of county commissioners in each of our counties that we serve in. And then there is also a senior advisory council and a disability services advisory council that helps advise the board as well. So what we do here in this county is we're often known as the Medicaid office. So we serve consumers who are aged, legally blind, or those who have disabilities. And we also offer medical coverage for employed persons with disabilities. And let me know if I'm going too fast. Our Medicaid services, so we can provide that for in-home and community-based care setting. A community-based care setting is going to be like our assisted livings, our adult foster homes, our nursing homes in the county. And there are guidelines that individuals have to meet. There's a financial component, and there's also a physical component where we look at the activities of daily living. So we have case managers that go out and make an appointments with our consumers, as well as eligibility specialists in our office that look at the financial component. Now, there is a lot of rumor, I feel like, that people think it's kind of apples to apples in applying for financial services. Oh, you have to be in this kind of category in order to qualify. There's a lot of different variables. So when in doubt, we just encourage people to apply and let us sort out that piece of it, and we'll meet directly with consumers. Let's see, we also have Medicare savings programs. I've worked with Linda Dugan in the past with our senior health insurance benefits assistant, so she's probably familiar with this side of it. We can help our consumers, people in the county, help pay for their Part B Medicare premiums, and also to help pay a portion of the whole medical as well. So when we have people that are on a lower income, we want them to come in and try to apply for these benefits to see if they do qualify, because there's a lot of, we find a lot of people that could qualify for having these Part B premiums covered for Medicare, and there's Medicaid that can pay for that. So we can kind of assist them in that portion of things. These programs, they're not full medical packages, but they can help people pay for their medical. Then we also are known as the SNAP office. So self-sufficiency here in the county does that as well. I should kind of rewind a little bit. The state of Oregon, we're kind of known as a storefront, no wrong door. So you can come into our office for other things beyond the SNAP and the Medicaid and things like that. We specialize in the long-term care for our seniors and people that are disabled, though, and with the SNAP benefits. But we can help the application process for a lot of benefits across the board. So that is important for people to know. We stay pretty busy in our location because we are located here in Warrenton, just down the street from the jail, the animal shelter, the food bank. So we receive a lot of traffic in our office, which is great. So again, we also have the SNAP benefits. So that is serving those under the age of 60 as well, but primarily in our offices, 60 and up, and who receive Social Security, disability, or supplemental security insurance. Individuals can apply online, in person, over the phone. And let's see, if they are receiving SNAP, they can claim medical expenses, and they might see an increase in their SNAP as well. So we will look at all of that, and we go over that with our consumers that come in. Then the other side of things, so that's kind of the Medicaid portion of it. We also are Older American Act programs, and I think a lot of people forget that we have that component because we're pretty much always known as the Medicaid office. But we help consumers over the age of 60 find resources and have assistance. We have a staff person in our office who's the community program supervisor. So that's helping individuals that might have aged family members, they might have an aged spouse. If they are an unpaid caregiver, we have programs to support them. We have educational programs. We network a lot with some of the hospitals and community programs in the county as well, with providing fall prevention, diabetes management, things like that, chronic conditions. Like I said, caregiving programs that can provide a little bit of assistance with family members, and it provides also basically kind of case management to help people through those hard times. So when in doubt, if somebody's going through a hard time looking for caregiving, they think they're over-resourced, they might be. We still have programs and we still have staff members that can sit down with them, help provide options counseling, which is really putting together a plan and helping them see the big picture. Maybe they're not ready to apply for Medicaid now, but maybe in a couple years down the road. We hate that, to have somebody spend down all their money, go move into a facility, and then they're not going to qualify down the road. So we can have someone sit down with them and go, you may not want to do that yet. Here are some options so you don't get yourself in a financial situation that you can't get out of. Let's see here. We also, like I did mention real quickly, our senior health insurance benefit assistance. So that's where we can help people with their Medicare options. So if somebody is trying to understand Medicare, they're new to Medicare, they can make an appointment in our office and we'll go over what their options are. We can help them choose Part D programs, their drug plan options. We can discuss their options for supplement plans. We can't sign them up, but oftentimes we put them in a position where they can make a choice, or else we'll assist them with the local brokers that we have in our county. So that's a great way for a lot of people who are overwhelmed with that process, just to have an expert on that side of things. We also have the meal sites in the county. So we have the Swenson Meal Site that oversees the Astoria area. We have the Warrenton Meal Site, and then we have a Seaside Meal Site. So that provides in home delivered meals. We've partnered with Meals on Wheels, so now we're known as Meals on Wheels Northwest. And so different parts of the county have different delivery days. So just call our office, or you can call our meal sites directly to get signed up for that as well. Let's see. Went over that. Any questions so far?
Suzanne, do you guys still have Sheba volunteers?
We currently do not have Sheba volunteers. However, we have the community program supervisor is Kim Combs in our office. She formerly used to be a quality assurance eligibility specialist, so she's got a good financial background and really understanding the qualification process, and so she will meet with people individually. Now, during our busy times, we will assist people to utilize our Sheba counselors in the Valley, because they can do Zoom calls, they can do phone calls as well. But Kim in our office right now, if it's not a busy season, she can take those on. So.
Okay, Amber has her hand raised.
Yeah, I have a couple questions. First question is, I'm wondering if you can tell us what your enrollment numbers are just for Clatsop County right now. And then I'm also curious how people typically become enrolled with you. How do they find you? How do they find out that this is available service to them? Do you guys advertise?
Good question. I have to do a quick little looking at my numbers. We have just under probably 400 people on long-term care services and support. So people receiving in-home care or people in facilities in the county. Then to get on services and whatnot, they can call us, they can go to the websites to get started in the process there. As far as advertising, we don't per se do any advertising. We work really closely with the hospitals, the social workers, word of mouth, the local self-sufficiencies, APD, DHS, all of them, and they come. The numbers come in. But doing things like this, our community program supervisor, she's out in the county, our meal sites, that the information just gets around. But yeah, definitely we can. I mean, we're not going to turn anybody ever away. We have our different times of the year that get pretty busy. A lot of the times we get a lot of phone calls after the holidays. Spring tends to be pretty busy for us too right now. So as far as numbers for food stamps and all that, I don't have that readily available. We could get that for you and get a better idea. But as far as long-term care services and sports, I would say it's just under 400.
I would be very curious to see those other numbers. So if you're able to
Okay.
get them, that would be wonderful. Thank you.
Mm-hmm.
Suzanne, I have a question for you. If you can speak to the Meals on Wheels program, I understand funding is being cut on a federal level. What's that going to mean for our local Meals on Wheels program?
At the moment, we're not being affected. Everything is business as usual. And so there's not anticipation at the moment of anything that we're concerned about. So I don't have a lot of details on it, but that's really what our executive directors are letting our agency know.
Perfect. Good to know.
Yeah.
Thank you.
Yeah. Same with our benefits across the board. We don't have any new information or news on any of that, but we're sitting good at the moment.
Good.
So we don't anticipate any concerns.
Wonderful news. I like that. Thank you.
Mm-hmm.
Any other questions or comments for Suzanne? If not,
Suzanne, when people call that ADRC number, the senior services number, are they still make appointments with you or DHS, or is it pretty much with you guys now? You know?
So ADRC, when they call that number, that's going to get directed with our agency, Northwest Senior Disability Services.
Okay.
So as I said, our agency is a 5-county agency. So that department is out of our Salem office. However, they're setting the appointments up directly with the offices that are impacted and that need the appointment. So the good thing about starting with ADRC is they're asking financial questions and getting everything started to see what is appropriate for a program to recommend and whatnot. So that's still the best way to go. We can start it at our side of things. It can be slower, oddly enough, from the office level when it comes to long-term services and sports. SNAP, they can come right on in. That shouldn't be a problem. And I should add, we also have the adult protective services out of our office too. We have two case managers that do the adult protective services out of here in the investigations. So. And those still go through a screening process too. People can call in directly or they can go to our website to fill out the APS form. And then that goes through a screening process. And then from there, it gets assigned to the APS case managers.
That's great. Okay, any other questions or comments for Suzanne? Amber has a question there. SHIBA, what does that stand for?
Oh, good question. That is. So it stands for Senior Health Insurance Benefits Assistance. The book, I do have a book right here. We have these out of our office. We have a few in Spanish as well. This is what the booklet looks like. You can get this online as well. This is a great resource because those Medicare and U books can be very daunting to go through. This kind of breaks it up, but still it can be daunting for people. But if we just go through and explain what the sections are, it's more easily to understand in that process. But yeah, if you're new to Medicare, switching over, we will definitely work with people and help it make sense, break it down.
Great. Any other questions or comments? If not, Suzanne, thank you very much.
There was a second part to that question. I just with some of those acronyms, I'm not familiar with them. So the SHIBA, and then also Linda, you had said about that phone line, the phone number that people
ADRC.
ADRC.
So that is Aging and Disability Resource Connection. So it's known as ADRC. Now, throughout the nation, it's Aging and Disability Resource Centers. So all the states have these in one form or another. just like a lot of the states have a form of SHIBA. Sometimes it's known as SHIP, and I think California might be CHIP, if I remember right. So the states all have some sort of form of these. So those are where you want to connect. So if you have loved ones in other states and they're trying to find, I mean, something as simple as housekeeping, they can contact these centers to kind of get, okay, what is recommended, what is with logged in with the state, right? So those are good resources and good places to begin when people are kind of whole new to the system and they don't know where to start. Those counselors there should be able to kind of ask the questions to kind of find out what their need is. And then from there, when they get into the local offices, we'll specifically help meet their needs and whatever they're wanting to apply for.
Those are great resources. Thank you for clarifying.
Yeah, you bet.
Great. Any other questions or comments?
I just have a clarifying question, Susan. When we're talking about Northwest Senior Disability Services, we're talking about you all don't provide developmental disability services, do you?
Correct. So that would be through Clatsop Behavioral or Integrative Services Network, ISN. We work with them as a community partner. Sometimes they might fall under our waiver. A lot of times, depending on what the diagnosis is or what they have or how their age as well, they're better served under that waiver versus ours. So we work with them to kind of have a determination. And so we will meet, it's very common we meet with people with developmental disabilities to determine should they come over onto our side. We'll meet with family members and they kind of decide what the best fit is.
Okay. I just wanted to, because this group works with the mental health and developmental disabilities. And so I just want to make sure when they understand the work that you all are doing and the work that CBH is doing on that contract.
Yep. And that's really important and that is kind of a gray area and it will make case managers kind of pause and make sure that I don't know if this is the best waiver, but then we leave it up to the consumer to decide too of what route they want to go on. So we just have to provide them the information. It feels like depending what is a lot of situations, CBH is still the appropriate way. Now, if they are aged, then we're definitely going to look at our waiver as well. But definitely is something that we have to look at and consider.
Thank you.
Okay. Any more questions or comments? Thank you so much for coming and a lot of good information.
Good. Well, let me know if you guys need anything else, and we're here for you guys.
Okay. Thank you.
Thanks, Suzanne. Thank you.
Take care.
Okay, let's move on to
Randy. Can we go back to the roll call real quick? It looks like there's Elena Green who came into the meeting. Are they still here? I don't see them anymore. Okay,
Yeah,
we had a guest momentarily, and then I also wanted to point out that Julia is now here as well.
Okay, thank you. Hi, Julia. Okay, thanks for that. All right, let me get to my next page here. Okay, presentation discussion health equity plan for Clatsop County Public Health, and that would be Jill Quackenbush. Jill, your turn. Okay. You have the floor.
Right on. And then I think, Lisa, you're going to share my slides, right?
Yes.
I'm gonna do a quick kind of background of why we're doing this health equity plan, as well as our planning roadmap. I'm going to go through those two things really, really fast. But I'll provide these slides to you if you have any additional questions afterwards. And then, because what I really want to do is be able to provide the key priorities and get your feedback on those. So go ahead, Lisa. So the health equity plan is part of our public health modernization. And just a quick history of modernization. Public health modernization, it's the Oregon Health Authority's approach to ensuring that local public health departments like ours have a pathway to provide the optimum services to all. The state has been working on modernization since 2013, and in 2015, modernization was put into law. And then in 2017, House Bill 2310 further clarified what the framework looked like, including the foundational programs, which are communicable disease control, prevention and health promotion, environmental health, and access to clinical and preventative services. And then the capabilities, which are leadership and organizational competencies, health equity and cultural responsiveness, community partnership development, assessment and epidemiology, policy and planning, communications, and emergency preparedness and response. That these were the capabilities that local public health departments needed necessary to protect residents, improve health, and achieve equitable outcomes for all. Next slide. Clatsop County Department of Public Health, we do receive funding from OHA, Oregon Health Authority, to implement the modernization framework. And as part of this funding, the county is required to complete a health equity assessment and health equity plan. We did a regional health equity assessment in 2021, and we partnered with Columbia and Tillamook counties to do that assessment. And the assessment described how different health factors such as housing, transportation, poverty impact health and the health behaviors in our region. The next step is for Clatsop County to complete the required health equity plan, which is essentially putting that assessment into action. We've contracted with Reed Group, who's a consulting agency who completed our assessment, and they have been working with us on our equity plan. Next slide. So our planning roadmap, we started out this year, January, February, just with initiation and planning. We met with our Board of County Commissioners, which is also our Board of Health and Local Health Authority, and also began talking with other groups. Lisa did share with the Human Services Advisory Council that we were beginning this process, started working on data collection and analysis, and then working with our core planning team, we began some strategic planning and prioritization. And here we are today at plan development and refinement. Next slide. So I believe Lisa shared these key priorities with you in your email documents. These reflect community input from local and regional health assessments. They're also aligned with the state public health modernization goals. They also build on existing momentum in the county in areas that are identified for growth through either staff surveys or partner feedback. So family support and childcare, and again, remembering that the original assessment was done in 21, and I think you'll recognize that with some of these things, there's been like a lot of work in the community that is already occurring on some of these priorities. But this is so family support and childcare is a foundational determinant of health. So looking at how to support family-based support services including childcare, especially for low-income and rural households. The second key priority that was identified was youth substance use. This is an emerging issue. There's a lot of existing momentum right now with community partners and with schools to reduce youth substance use, including tobacco, cannabis, and other drugs through school and community-based strategies tailored to the groups most impacted. And then the last one that was prioritized was Clatsop County Department of Public Health internal organizational capacity for health equity. And this may look at, like how can we be engaging the community with our LPHA, our local public health authority, in decision making and planning. How can we improve culturally responsive services within our department, which may include linguistic services, and it may mean like doing feedback loops, doing more listening sessions out in the community, and then accountability mechanisms that really reflect our department's commitment to equity. Next slide. And then our next steps, we'll go back to those key priorities, but I want to also stop sharing so that we can talk about those priorities. But real quickly, the next steps are ongoing community outreach and input. So getting some input like from Human Services Advisory Council. And Lisa's been working on meeting with some other groups, and I'll let her kind of share what groups we are have committed to working with us on feedback. And then our final plan is due to the state by June 30th, and we will be going back to the county commissioners on first Tuesday in May, I think it is. I'm sorry, this is June, the first Tuesday in June, the first work session in June to share both the key priorities as well as the community inputs, because this at this point, this is our time where we can kind of massage and look at what does community think about these priorities. So we can stop sharing unless anybody has any questions about the slides at this point.
Questions? Comments?
This is Linda. I do. Jill, I'm just wondering why, the homeless with the drug and mental health issues, why that's not on there. That's a huge county public health issue. Why isn't it on your list? Yes.
So that did come out in the health assessment. And one reason it didn't come up on our key priorities is because there is a lot of momentum already in the community around that, and there's groups and efforts working on that. So it's not that we wouldn't address it at all. But for this health equity plan to be able to come up, we needed to be able to narrow that scope. And that was something that our group actually talked about, our planning committee. We did kind of go back and forth on that as well.
Because there needs to be a county-wide coordinator, because they're talking about, pushing them from Seaside to Warrenton to Astoria back. There's not a county coordinator for them. And to me, that would be the public health department helping with that. So that's disappointing for me. Yeah. It's not on there.
I will just kind of speak to that. And so the county works actively with all of the cities. And when we started trying to address the shelter issue, working with the cities so that we had shelters and services in each of the cities, because we don't want to see them getting pushed from one location to the next. And so from a county-wide position, the county can't tell the cities what to do in regards to their exclusion zones, their camping ordinances, or any of that sort of thing. And so when we were working with the cities under the direction of the board, it was to work with them so that way they have the shelters and the services within each of their cities, should they choose to have them.
But Monica, this is the mental health and drug use. I mean, I understand the shelters. You guys have done a great job, and there's housing for everybody.
Yeah.
But some are choosing not to do that, and because of the drug and mental health issues. And nobody's addressing that at this point.
So yeah, I mean, that we can have further conversations about it, but we are, the county public health is different than behavioral health. And so we do contract with CBH to do behavioral health services and drug treatment. And then the county does, within public health, does do the prevention aspect of it. So there is coordinated work, but unfortunately, we can't force people into treatment, whether it be for mental health treatment or drug treatment. And so,
but you've got the youth substance use on your list.
Yes, because there is active work being done around adults, and there hasn't been a lot of momentum around youth still.
And I also I do appreciate this, and this, we will add this feedback. So this, part of this is getting more feedback for what the community feels are concerns around health equity. So we can definitely add this feedback as part of community input.
Thank you.
Yeah.
Okay.
So,
okay.
I think Amber had her hand.
Amber had her hand raised. Yeah.
Thank you. I have two questions. One is the something that I don't see on there that maybe this is outside of the scope of this, but the lack of providers in our area, I feel like is a big equity issue. And are there any efforts to encourage providers to move to this area so that we have more capacity as our population grows?
Mm-hmm. Okay. Thank you.
Mm-hmm.
And Lisa's, just so folks know too, Lisa's taking notes on this as well, so that all of this input will be added.
And then my other question was just I had the honor of being interviewed for the youth prevention, and I'm wondering, is that a piece of this? Are they related at all, or are they separate?
Yes and no.
Right.
Definitely. Part of it is timing. We're doing both assessments, and so a lot of that work has also informed how youth substance use became one of the top priorities, because there is a lot of work there. But I thank you for that and recognizing as well.
Yeah.
And that actually, when I talk about lack of providers, that is an area where I see, for youth substance use, there are not, and I feel like too, when I say providers, it's also access to, oh my gosh, I'm blanking on what I was going to say. Circle back to me. Let me think for a moment.
I think, Amber, one of your questions there, getting providers out here, a lot to do with that, which is difficult, is the lack of affordable housing as well. Lack of housing, period, to get providers out here. So that's a tough go on that one.
Absolutely. And I remember now, like specialty providers. So providers who, are narrowing in on youth, right? The substance use, for addressing that just for youth, like that's where they specialize. Mm-hmm. And so it's not just providers, it's providers that are going to meet the need, if that makes sense.
Yeah, so would you, so kind of looking at, so with the priority around youth substance use, like would one of the barriers to addressing that would be like not enough providers that have specialty, and then also that point of like housing for providers to come. So would that be an accurate kind of based on what folks are saying?
That's exactly,
Feedback
yeah,
on
that's
this?
exactly
Okay.
my perspective. Yeah. And just anecdotally, you know, I have some youth that I work with that I have referred for substance use counseling, and they, to my knowledge, there's only, I think, one counselor that's available. And I believe that that counselor does not have specialized training in working with youth. Not to the level that I would like to see anyway, and nothing against that individual. They're a wonderful, skilled person. But it is frustrating to see a need that really can't be met in the way that it should be in an equitable manner.
And I'll just, I know Shira can't talk right now, so, and we're not going to kind of go in that direction right now, but I will just point out that this is also something that CBH is interested in. And so I'm sure that at some point Shira will, when she's able to, be able to share more information on that when we're not talking about the health equity plan.
Thanks, Lisa. Any more comments or questions?
So do these, so I guess so we have a few questions, and I know that Lisa did send them out. And so for anybody else, like, do these priorities feel relevant and important to our community?
Linda's shaking her head no. So I think we know why.
Yeah, I
and
didn't want to
Linda,
take
is that because you want to see the housing piece?
Well, we have plenty of housing. It's
Or
with the mental.
the houseless.
Yeah, they choose because of the drugs and mental health issues. Yeah. And a lot of them are seniors. I feel like we are ignoring our seniors as well. Yeah. Because we have family and childcare and youth. But the older, most of the homeless are older. And a lot of the mental health and drug use are causes. They choose to live outside of housing.
Yep, yes, they do.
We're totally ignoring that population.
Commissioner Thompson has her hand raised.
Well, I do. Isn't this an interesting discussion? I feel like I'm back home because I started in social work a long time ago and decided I wanted to work on those other aspects like housing and the economy and all that sort of thing. But back home with you all is interesting because when Linda talks about the unmet need and the houseless population, it isn't just in cities. The enclaves in the unincorporated areas, I don't know that it needs to be called out as a particular identified subset, but some of the most problematic issues for neighbors are when there's I almost want to call it a contagion of gathering of people in vans and tents and maybe around someone who has housing, but then a whole community of drug using, otherwise homeless people can accumulate there. And I don't know if that's in the scope of what you want to be focusing on, but I'll tell you, as a county commissioner, I get a whole lot of input from community members concerned about that, from I would call them, they're refugees from urban situations. And they come to the rural areas, and it's more and more challenging to get them interested and involved in service providers. And they can be all ages, but primarily a middle-aged or older demographic, I think, if what I hear is accurate as a reflection of reality. Thank you.
It's a good point, Commissioner Thompson. I'm living that experience right now every day in Seaside across from my business with the houseless camp in Seaside. So I see that every day.
Julia is raising her hand.
Julia, yes.
I just want to put a word in here as a mental health provider and talking to other private practice mental health providers in this town. We get so many more calls than we can even answer sometimes. I do my best. The other issue is then when we refer to CBH, people will say they're not getting a call back. And when Shira can talk to us, I would really like to have that conversation, what we can suggest to these people when they're saying they're not getting a call back from CBH. I have one person who their family members coming back to the town after leaving 5 years ago with a mental health break, and now they're coming back. They've been in treatment, been homeless, been a lot of ways. They're stable now. They're trying to come back and get connected with CBH so they can stay stable, but they can't even get a call back. And so I know a lot of people are getting a lot of services from CBH. So I've heard that answer before. I'm just not sure what else to tell these people. So
Shira put in the in the chat. We track all our engagement calls and likely have evidence of our outreach if you ever want to follow up on what we have done.
Okay, and just if there will be somebody I could tell these people, I don't know a lot of information. I do about one. I can have somebody reach out specifically, but it just seems, I know they do a lot. I'm not saying they don't, and I'm sure they're in the same situation we are. But just if there's somebody we can say, call this specific person, I think it could be helpful.
Shira says, who specifically are you saying aren't?
I don't think she can say the person's name. That wouldn't be appropriate.
Right.
But I do want to just echo what Julia is saying, the, capacity, right? Like all of the mental health agencies are just beyond capacity trying to meet all the needs. And I don't want to go down a different path here, but the policy changes that Care Oregon is making it so associate level mental health professionals will no longer get reimbursed and can no longer meet OHP clients' needs, just limits further availability and increases the capacity placed on CBH.
Shira put out that she meant population, not person.
Yeah, and I think
I'm specifically talking mental health.
I think to what Shira is asking in regards to the population is because they do have folks who are going to be, you have people who are looking for a mental health service. You have people who might be a co-occurring situation where it's mental health and drug. You have youth mental health, and so I think that's where sometimes, trying to say call this person, it might not always be that person, because depending on the population that you're calling about, it might be a different individual. And so she also says that they have drop-in services in Seaside and Astoria, and they can come to the clinics without appointments Monday through Friday, 8 to 5. So I think, a lot of it to both your point and Amber's point as well is it comes down to capacity and trying to figure out, okay, who's the population that you're calling for, so that way we can get you in touch with the right person who's going to provide that service.
And I was specifically mental health. I just feel like there's more people calling and saying they're not getting callbacks. And Amber's right. I don't have specific information. I like the information I can give them. You can do the walk-in when that's appropriate. It's just very hard sometimes to know how to support people.
It can get very disheartening.
And following up on what Linda was saying too, I think some of our homeless people really are challenged to get and maintain services, and then the homeless issue follows. And I think that's why that Esperanza Village is so powerful, because there's people right there that can teach them how to maintain services so they don't get in the cracks. It's a huge issue. but I just really feel like I get too many people saying I've tried to call CBH and not getting a call back.
I am wondering if there's a way to increase, not networking, that's not the word I'm looking for, but at CBH, if these people are calling the wrong team of people, then maybe there's some kind of mechanism that can be put into place where that message is getting to the right people, so that so it's not the onus isn't put on the person seeking help, right? Because they took a step, and it can be sorted within CBH on who's going to reach back out. So if they are reaching out to the wrong team, they're not left in the dark.
So,
Okay.
yeah, thank you.
And so Jill, sorry to interrupt, but just Jill, your plan is great. I'm thinking, I'm following up on what Linda's saying, the collaboration between the services. I think that's where sometimes people get confused when they think they're reaching out to the right person and they're not. And I think that's huge for a community-wide plan.
Thank you. And I think we could keep, I would love to hear more, but I do have to give the agenda back to our chair. But I do encourage you, I know that Lisa did send out the questions, but if you have any ideas, like how public health, right? Looking at the priorities or other things that you might think are more relevant or should be a priority in our community, like what is public health's role? What are some things that public health could be doing to best support that? And what does meaningful engagement of public health look like to you? And then we will keep you informed how would you guys like us to keep you informed about the next steps with the plan? Just coming back to this to report, or what would that look like?
I think maybe coming back to report at our next meeting, whenever that's going to be, and if anything's like extremely important, that maybe just have Lisa send out an email to the group and to keep us filled in. I think that might work out.
Okay.
Yeah.
Awesome. Well, thank you guys.
Okay, we'll continue this discussion. That was a lively discussion. Yeah. So, yeah. Okay. Thank you, Jill. Appreciate it. And let's move on. Losing track here. Okay, let's move on to provider reports. And Shira, CBH, Shira has stated in the chat that if you have any questions for her, you can put them in the chat because she has laryngitis and she obviously cannot speak right now. So with that, we're going to move on to Lori, but Lori is not present, and Carrie Seals is going to take her place and chat with us. So Carrie, you're up.
Yeah. I don't know if you can hear me.
We can hear
sorry
you.
for my lovely office. I didn't quite make it all the way where I was intending to be. So pulled over and found a nice little park to sit at. Lori asked me to step in for her today. Not a lot to report on our end. We are Randy, as you know, is part of our DD advisory committee, and I'm really proud of the work that we're starting to do. We've developed some priorities for our community, and we'll start to meet with our subcommittees starting this month during our meeting, which is on the 14th. I'm diligently sending out a newsletter. It's not always super great, but I'm always happy to, if there's ever any information that you'd like, this team would like to get out to our community, please let me know and I can stick that in our newsletter. I just put in the chat a question about, Lisa, I know that we had talked about you coming to our next meeting, and then during our meeting, we decided to hold it as subcommittees. But if this is something you think that it would be appropriate for me to send out in an email to our population to solicit feedback, I'm more than happy to do that. I just sent out our newsletter this afternoon, and so I can send a little update and send those questions out if that's helpful. So please let me know about that. And I don't know, not really sure what else to report out, but things are going well. Yeah, any questions, please let me know.
Carrie, I have a question. Did we decide our developmental disability advisory group to have Lisa and Jill in next Wednesday?
Well, Randy, you're the only one that's responded so far. So if you get the vote, then I would say yes. I'm hoping that folks will be okay with that, just kind of gathering up for, I think, Lisa, you said about 20 to 30 minutes. I think that makes sense. And then we can all go off into our subgroups. I think that would be fine. I'm assuming, but I wanted to give folks a minute to respond. So I will let you know next week for sure.
Okay, there was two other members that did respond saying that they would enjoy that too. So I think
probably
there was
happened while I was driving, so I haven't had a chance to see yet.
No, okay. that came in yesterday or last night. I saw after you put
okay.
out. Yeah. Okay. So there was 3 or 4 of us that responded yes. So.
Oh, interesting. Okay.
Yeah.
Thank you.
Yeah, you're welcome.
All right.
Okay. Any comments or questions for Carrie? If not, thank you, Carrie. Appreciate your report. And let's move on to County Commissioner report. And Commissioner Thompson, welcome to our group. It's good to see you.
Well, thank you. Let me give you a quick establishing of my background. I have a master's degree in social work from the University of Michigan. I was accredited with the International Coaching Federation to do life coaching with individuals and groups, which was like another master's degree. I've worked in 4 counties in 3 states, including at top levels, being a statewide director of a couple of different programs. I've worked as a volunteer. I came into county commission work because I wanted to integrate policies and priorities with what was happening at grassroots in a way that gave me more freedom to listen. And I do a lot of listening. So I have organizational capacity because I've come in at the bottom and worked my way up to the top. But I also have a profound interest in how we make a difference in communities. So I listen to people all the time. I am delighted to be here with this group because one of the things I do is I work full time as a county commissioner. I don't know if you know, Clatsop County is one of 2 counties in Oregon where the commissioners are volunteers, but I waited to run for the office until I could devote myself to it full time because I knew what the job could be and what I thought it should be. So I spent a lot of time in Salem at the Association of Oregon Counties. Part of what I do there is head up a policy committee, one of 5 policy committees with a colleague. So I can talk about revenue and governance and economic development because I see that they play a big part in what we're able to do in our county for the people who need help of all kinds. I also go to the local government advisory committee, and that's a specialized committee to improve the relationship between counties and the directors of the Oregon Health Authority and the Department of Human Services. So we're in face-to-face meetings. Being here in this meeting with you will give me the information that's useful so that I can be that conduit of information to give you access to the people who are making decisions that impact what we're able to do and how we're able to do it and with whom. So that's my short and sweet. Just tell me what I need to know and I'll try and make good use of it. Thank you.
So Commissioner, I just got to say, I really appreciate you taking us on as the liaison for the county commissioners, and we haven't had a real one-on-one with county commissioner recently. And I hope you'll be, in the past, a few years ago, one of the county commissioners was appointed to us or volunteered for us, and she was at all of our meetings, and that was before COVID hit, and we were in-person meetings, and she was at every one of them. She was very committed to us, and I for one, miss that. So I appreciate you stepping in and taking on this role, and hope we can get back on track with the commissioners.
Absolutely. I had another friend, a colleague, say to me, "Leanne, you don't have to go to every single meeting." Well, yeah, I do. Yeah, I do. So I'll do my best. If we're back in person, there's some ways that that's easier because the side conversations before and after, I think, are very, very useful when we're really trying to look at reality and improve it. So help me do that. I want to commit to being present.
Yes, networking like that in person is very helpful. And then one more comment for you. I remember back in, I believe it was 2021, the commissioners reappointed me to my, I think it was my three-year term. And afterwards, you actually called me to congratulate me, and I really very much appreciated that, and it stuck in my mind. So I'm glad to see you here.
Bless your heart. Well, see, because I can remember all my sins, but my good deeds kind of fall out of my brain. So thank you for presencing the good stuff for me. I'm glad to have made a difference with you. Let's keep doing it.
You did. So anyway, welcome to our group. Any questions or comments for Commissioner Thompson?
I would just like to echo what you said, Randy. Leanne, it's really nice to meet you. I'm excited that you're here. And it has, we have felt that the presence of a hole of not having that connection. And I am very optimistic and hopeful. It sounds like you're going to be a wonderful liaison. So thank you so much.
Yes.
I'll do my best to live up to your good impressions. Thanks.
Any more questions or comments for Commissioner Thompson? Okay, let's move on to County Management Report and Monica.
Thank you. I am just going to attempt to share my screen really quick because I did just want to provide you all with some information that we got in our last deflection meeting. So we've talked to you all before about the deflection program, and this was a result of the Measure 110 reform, and deflection went into effect. The deflection program went into effect on September 1st of 2024. And so we meet regularly. CBH is an active partner in that, as well as the sheriff's office, and the deflection coordinator is based out of the Community Corrections Division. And then our committee that meets regularly includes representatives from law enforcement, Seaside PD, the sheriff's office, defense attorneys, the DA's office, and the courts, and then CBH, of course. And so we have the state, since this is a statewide program, created a dashboard. And so I will give this link to Lisa, so that way when she sends out the information, you all have access to it as well. But I bear with me because we just learned about this a couple weeks, or last week, I think it was. And so I'm still trying to figure out how it all works. But this is the homepage, just kind of talks about the House Bill 4002, which was kind of reforming Measure 110 to recriminalize controlled substances. And then there's different statistics. And so this is an interesting one. And I guess I should ask, can you all see my screen? Okay.
Yeah. Yes.
And so you'll see just this area here. These are those individuals who were processed, fingerprinted, whatever you want to call it, for possession of a controlled substance prior to COVID-19. And then this is during COVID-19, but before Measure 110. And then this is Measure 110. And so all the individuals, or lack of individuals, who were arrested as a result of Measure 110. And then this is House Bill 4002, which is recriminalization for possession of controlled substances. And so you see that there are increases again now that law enforcement is able to take some action. And then this over here, these are just all 36 counties. those who are participating, which is the majority of them. So Clatsop County here is up in the corner, and we have 31 arrests. And so then it also breaks it down as to what law enforcement agencies are making those arrests. And so you'll see countywide there's 31. 12 of those have come from Seaside PD, 6 from the Sheriff's Office, 5 from Warrenton, 4 from Oregon State Police, 3 from APD, Astoria, and then 1 from Gearhart. And so those are all the arrests, but then you can break it down further and you can look at what is called an arrest for possession of controlled substance only. So of all 31 arrests, there were only 7 that were arrested for only having possession of a controlled substance. And then the others were then arrested for also having other crimes, whether that be drug delivery, trespassing, theft, those sorts of things. So those are the arrests. These are the cases, which means those that have been arrested and then referred on to the DA's office for prosecution. And then going to just wanted to make sure, sorry, I feel like I'm forgetting something. But then going to our deflection, the program and how it was funded for all the different counties. And so this is the funding overview. And so, sorry, I feel like I said, I'm still working on some of this, and I had it pulled up so that way I could show you all. Okay, so here's Clatsop County, and Clatsop County, we received for the biennium $453,888. And then it further breaks it down as to, further breaks it down to how our funding is allocated. And so for the build of the program, and so as far as our community and our partner expenses, so that those are staffing, supplies, training, we have 270,000 allocated to that. And then for law enforcement, as far as just some of the supporting supplies for the law enforcement agencies. And then for the services, which includes treatment, housing, and other client support, that's another 180,000. And so some of those, and unfortunately, as we all know, Shira can't speak since CBH is the one that's providing all of the services. But some of the things that they are doing is what's called contingency management. And so that's what some of those funds are allocated for, because that's what helps people stay engaged. This is a voluntary program, and we offer it, but not everybody chooses to take it. And so then that's when, if they choose not to take it, then that's when the crime then goes on, and the DA chooses whether or not they're going to prosecute that. We have, pulling up my, we have had a total of, we have a total right now of 8 folks who are actively engaged in the deflection program. We have 1 individual who is currently in jail, who's supposed to get out next week, that has said that they are going to choose to participate. So that would be 9. And I believe we've had 4 graduates to date, and it's a 90-day program. Linda, I see that you have your hand up, and I see Randy does too, but you have yours up twice. So go ahead.
Oh, I think I was second. Randy's
Oh,
first.
oh, is that what that means? Oh, duh. Okay. Randy, go ahead then.
Okay, so I got a couple of questions.
Yeah.
On a per capita basis, where does Clatsop County rank in all of this? Do you have that statistic at all?
So I don't know, like, per capita right off my head, but that when this first came out, I just did some quick math, because if you go back and you look at, I believe it was Multnomah County that had 393, I believe it says, and ours, and then you took their population, we were both at like 0.007. So I just thought that was interesting that both Multnomah County and Clatsop County were similar per capita, but I can't say for like 0.007 of our total percentage, how many people, like, again, it's 31 people, but that's only 0.007% who have been cited for the deflection program. So that's not to say like this isn't all of the people that we know that have other crimes, because not everybody is eligible for deflection. So does that make sense?
Yes, it does. My other question was on the funding. You had law enforcement as 1%, and that was for supplies. Two-part question: what supplies are you talking about? And then why isn't there any, or is there any training? And if not, what does that entail and why not?
So the training that has been taking place has been more, oh gosh, and Shira, if you can help me remember, it's a type of interviewing, and I'm drawing a blank on the type of interviewing.
Motivational interviewing.
Oh, thank you. Yes, motivate. Oh, thank you, Jill. It's like motivational interviewing. And so the trainings that we have been doing have been, a lot of them have been with OHSU, because they're actively involved in this process. And so there haven't been costs to the training. And then we've also, some of the supplies that's not a law enforcement supply, but it's a supply for the program is, and I believe Lisa talked about it as well, but we have the TrueNarc drug testing. And so that is something that makes it so that law enforcement is able to test a substance on site, and we're not having to wait for it to go back to the lab. And that's positive because it helps us get a better understanding of the types of drugs that are on the street. But it also is important because when you are when you're arresting somebody for possession of a controlled substance, more often than not, the intent for that person is to use those substances to get high. But oftentimes their drugs come back as not being drugs at all, because people are just trying to make money off of somebody's addiction. And so you have to drop the charge, even though you know that that person's intent might have been to use illegal drugs. If they are not, in fact, illegal drugs, then you can't charge that person for anything.
Yeah. Okay, great. Thanks.
Linda?
Yeah, I was wondering, do we have access to this program? Is it public?
That's what I said. I would share the link with Lisa, because we just got this in the deflection meeting, and so I'll share the link so that way you all can go on it and see it.
Okay, I missed that. Thank you.
Yeah. So we I just wanted to give you all a quick rundown about it. And again, folks have to, and Shira also put in there kind of just in regards to what the purpose of contingency management is. Again, this is intended for people, to try and help them get the help that they need to not use drugs. But we cannot force somebody into this program. And we surprisingly have had a number of people who have said, I don't want to do it. And they'll take the, whether that be go to jail or whatever other situation it might mean for them. I also just wanted to share just kind of some changes that have happened with it. So when we first started this program on September 1st, we didn't know what this was going to look like. And to Randy's point about training, there are a lot of new law enforcement officers who at DPSST training didn't go through search and seizure training to the extent that they used to, because you couldn't do that on folks. And so now trying to incorporate that back in for some of these law enforcement officers to understand the process. And so we didn't know when we first started this what the influx of individuals was going to be. So we wanted to try and control the population. So at first, when we did this in September, the only way that a person could get into deflection is, one, if they're a resident of Clatsop County, and two, they were found in possession of an illegal drug. As of February 10th, we have opened that up because we want to try and get more people in to get more help. So it's those same 2 criteria to begin with, but then we also expanded it to include those who are currently on probation or post-prison supervision or parole in Clatsop County, those facing non-violent lower-level charges with no identified victims, and those who have active arrest warrants or failure to appear charges. We want to make sure in some instances that we are not offering people who have victims the opportunity for deflection, because we also want to protect the victims' rights. And then also we expanded it. I apologize. Yeah, okay, I'm just reading it wrong. We also expanded it to those who are experiencing addiction and just want help. So oftentimes law enforcement, when they're out on the street, they might see somebody that it is evident that they're most likely under the influence, but they do not have, you have no reason to search them for a controlled substance, and so therefore you can't. But you can still offer them. And so we expanded it so you don't have to commit a crime, but we can offer you the opportunity to enter into the deflection program. So Amber or Randy, did you have another question?
Oh, I don't know.
Oh, okay, Amber.
Okay, thank you. I'm just wondering if anybody is collecting any data on why the people who are choosing to not enter deflection program, the reasons why, so that we can determine what barriers might be in the way.
Yeah, so our deflection coordinator does try to get that information. Oftentimes the people who, when an officer is citing somebody and they are offering them deflection, they make contact with CBH immediately. And so CBH is there to try and do a warm handoff. If CBH isn't able to be there for the warm handoff, then the officer will take them either to their Astoria or Seaside locations. And then in some instances, if the person says, yeah, I spoke to they have CBH on the phone, I want to do deflection, but CBH doesn't need to come, I'm going to sign your form and I commit to doing this. They have, I believe it's 72 hours to appear before CBH. And in some instances, they don't appear. We have had people who just say, I don't want to go through treatment. It was hell and I don't want to do it again. I can do it myself. Thinking that they can quit cold turkey, that they don't have a problem that badly. And so, yeah, just to kind of add to some stuff that Shira has put in there is deflection creates opportunities for interactions with behavioral health providers to offer meaningful care rather than criminal charges. And then also they have a swing shift peer who works after hours, so they can be available to law enforcement for immediate response as well. So they have tried to expand their services to not just be, Monday through Friday, 8 to 5, but 7 days a week and have more hours available.
Okay.
And I think that's all that I have.
Okay. Any more questions or comments for Monica? I'm going to try to speed this up a little bit because we're running out of time. Any more questions or comments for Monica? Okay, let's move on. Thanks, Monica. That was a lively discussion as well. Thank you. Let's move on to public health report and Jill.
I don't have anything else to report. I was using my time up with the health equity plan. I'll let Lisa go, and then if I think of anything else.
Okay, thanks, Jill. Lisa, you are up.
We're still working on our youth prevention needs assessment. Thank you to Amber for in your work as providing counseling to youth, giving us a key informant interview. We're also going to be doing focus groups and a survey focused on school staff and youth serving organizations as part of that, and looking at data. And then we've been doing some outreach with the schools. Last night we went to the multicultural fair that Seaside School District had, which I heard was a really fun event to attend. I wasn't there, but we were offering Narcan and from our harm reduction program, and also resources, and we have a vaping education campaign we're doing as well. So we gave out some swag from that too, to encourage people to check out the website and get more information about the facts of vaping and vaping cessation information. We have staff out at Jewel School right now doing a prevention fair there that we partnered with Columbia Health Services, who has the student-based health center there at the school, and also CBH and the tobacco cessation specialist from CMH is there as well. Yeah, and Shira wrote that they're there today too. Yeah, we're happy that they were able to come. And then we're working on the community baby shower. And then just to highlight some of our programs that we do that have to do with supporting folks who are houseless and potentially experience substance use disorder. We have our harm reduction program. We go out every week and we connect with folks, the majority of whom are houseless, who need syringe exchange services. We also ask them about what other kind of resources they need. CBH has a peer who goes and does that as well. And we're really happy to have that service we're able to offer and connect people with other community resources and resources that we have available in the department. Commissioner Thompson, you had a question?
Ma'am, if I could just encourage the coordination between the code compliance officer and the harm reduction team, I would urge that. It would seem like a clear, direct avenue to success, I hope. Thank
you for that suggestion. We do share our resources with them, but there's always an opportunity to collaborate more. And I think that's it for me.
Okay, any questions or comments for Lisa? Okay, thanks, Lisa. Now I'm going to have a question for you in a minute here, Lisa. Let's move on to our next meetings here. A couple months ago, I brought up the fact about that we are only required as a group to meet quarterly, and we've been meeting monthly, which is great. So we talked about if we don't have anything urgent, we could skip a month. So looking at next month, Thursday, June 5th, do we have anything pressing, Lisa or Monica or Jill, coming up in June that we need to chat about?
Jill has her hand up.
Yes, Jill.
I don't know. Oh.
Not that this is pressing for your question about June. I was just going back because for my report after Lisa we are also working on the community health needs assessment, and I'll have Lisa send out the link because we are doing a survey, health survey for that. So if folks A, can take it, and B, share it widely with folks that you work with and come in contact with throughout the community.
Okay, Commissioner Thompson.
Sir, if there's some way I can be prepared to respond appropriately at the commissioners meeting where the plans are coming forward, maybe the whole group doesn't have to meet, but if somebody can reach out to me and brief me specifically so that I'm ready to both advocate and respond when the county commissioners hear the plan, that would be helpful. Thank you.
Okay, yes. Okay, so what does everybody think about foregoing our next meeting on June 5th, and which would mean our next meeting after that would be July 3rd, the day before the holiday? Now, would that be a conflict for anybody? That's something we got to look at there too.
I'm wondering if it might not be a good idea to meet in June and then postpone the month of July.
So we'll go 2 months and go into August for our next meeting.
No, meet in June.
Meet in June.
Meet in June and then
forego
postpone July.
because of the holiday. Yeah.
Yeah.
Okay. What does everybody else think about that?
I support that idea.
Okay. Everybody else good with it? Okay. Let's do that. Would be helpful for me to have our communication. Shira's okay. It's fine with Shira. Okay. If everybody's okay with that, we'll go ahead with our June 5th meeting, and then we'll forego our July 3rd meeting, and we'll meet back up in August after that. Question for Lisa for proposed topics. So I'm going to fall back on the TrueNarc County's new tool, substance abuse or substance tool. Refresh my memory. Who is the coordinator of that? Do you remember?
Yeah, that's Christina Schultz.
I would like to see if we could possibly get her to present to us. This is kind of an interesting topic for me.
Yeah.
I can reach out to her, Lisa, because I've been communicating with her this afternoon.
Sounds
Okay.
good.
Maybe if she's available for our June meeting, that would be great. If not, we can do it, you know, she can present in August. So cool. Thank you. Okay. So we'll move on. Our next meeting, Thursday, June 5th at 3 o'clock. Anything for the good of the order? Monica.
Sorry, I just want to kind of follow up on the conversation that was taking place earlier regarding CBH, and then Shira's comment. For an agenda item, would CBH coming and talking about some of the how folks might be able to get connected? Would that be something that would be
Yes,
good?
absolutely,
Okay.
absolutely. Let's add that to the list.
So if that works for you, Shira, I know you can't respond, but
yep.
Okay, perfect. Thank you.
Yep. Thanks, Shira. Okay, if that's it, nobody else has anything, we'll go ahead and adjourn. It is 4:31 p.m. and we'll see you all again in June. Thanks, everyone. Good to see you all.